Have you hurt your back or you have low back pain and you don't know if it's a big deal and whether you should be worried? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Low back pain is a problem that afflicts so much of the population. A huge percentage of the adult population will have back pain at some point in their life. I know I've had 2 episodes of excruciating back pain, so I know how difficult it can be. Now, a lot of the times, low back pain is muscular in nature and not a sign of a serious problem. Now, there's all kinds of diagnoses, basically injuries of your lower back that you can have that could be something serious, maybe even need certain types of surgery. And it gets way beyond the scope of this video to go through all of them. But I want to give you a few signs and symptoms that you might look out for so that you might say, now I'll go get this checked out sooner rather than later. And most of those, really all of them, are in what we call the neurologic symptoms. Basically, nerve irritation or nerve compression. And in this case, with the lower back, it's going to be likely from a herniated disc. The bones of the lumbar spine are separated by these discs. And what can happen is that you can actually have the outer part of the disc rupture and the inner fluid leaks out and puts pressure on the nerve root. And then when that happens, you start to go from having just pain in your lower back now to maybe having pain that radiates down your leg. Or maybe you've got numbness and tingling in your toes or your foot. Or maybe it's weakness as you try to push your foot down or pull your foot or your toes back up towards your head. Those are potentially symptoms of a neurologic issue, either that one nerve root or maybe the entire sciatic nerve. But if you have that, especially if it's getting worse, might be worth going to see a spine physician or a spine surgeon. Doesn't necessarily mean that you're going to need surgery. It may be rest and anti-inflammatory medications or an injection of some sort, but sometimes surgery is in order. So if you have those types of symptoms, or especially if they're getting worse, maybe you ought to consider getting it checked out. Okay, I would love to know the #1 challenge that you face with your injury. Whether or not it's low back pain, I would love to hear it basically straight out of your mouth. If you go to the description below this video, the top link you'll see will take you to a page on my website where you can type as much as you want about the challenges that you face. That information helps me understand what you're going through so I can create more courses and videos and resources that help you better. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my YouTube channel. You'll get notified when those are published, plus you'll hear about my Ask Dr. Geier live videos when I'm on YouTube Live. Thank you so much for watching, and I look forward to seeing you in our next Ask Dr. Geier video very, very soon.